Hello, everybody, and welcome to the Tuesday edition of Video Clips. This video is brought to you by Wellness Forum Health, the Wellness Forum Institute for Health Studies, and Make Americans Free Again. I have just a couple of quick announcements, and then I want to get into today's topic. So first of all, this Thursday, Thanksgiving, we're having a potluck, a vegan potluck at our office. Anybody's welcome to join in Central Ohio. It's 1 p.m. Eastern. We'll have lots of food. Bring food with you. Don't bring food with you. Just come if you'd like to. Do send an email to me, pampopper@msn.com, and let me know if you're coming. We just want to make sure we have enough paper goods and all that good stuff for you. Second thing, next week is Optimal Health and Life with Pam Part 2, Healthy Aging. Holiday cookies, time to order so we can get them shipped to your friends and family in time for Christmas. And you call the office to order, all right? We're strange people. We like to talk to our clients and our members and that sort of thing. And we're having a fundraising party on the 16th of December. We'll have a DJ and dancing and silent auction. And we had a wonderful time last time. You're welcome to join us. If you want any information about this stuff, just send me an email at pampopper@msn.com. And after the Thanksgiving holiday, I'll give you dates for our free tour and free healthcare workshops. We have a lot of that kind of stuff coming up too. All right, the topic for today is the overdiagnosis industry. And I'll just start by saying, I just mentioned, I'll be teaching my Optimal Health to Healthy Aging class next week. And one of the most common questions I'm asked by particularly older people is, I'm seeing my doctor for a checkup this week or next week. What test should I ask him or her to perform? My answer, well, first of all, maybe you want to rethink the annual checkup. Almost all studies have shown it to be useless. But if you must see a doctor, for example, to have prescriptions filled, look into whether or not your prescriptions are necessary and or the potential to reverse the conditions for which they're prescribed. But the direct answer to the question about which tests to ask for, as few as possible, potentially none. And according to a recent article in Fortune magazine, you want to be particularly wary of cancer screening tests. And I was very surprised to see this in such a mainstream publication. I used to be considered an outlier in this area, and every time I would discuss the inadvisability of a lot of screening tests, I could expect a lot of hate mail from people who drank the medical Kool-Aid and believed that more medical attention leads to better outcomes and early detection saves lives and all that sort of thing. This has never been true, and more health professionals are realizing it and agreeing with me. One of the first mainstream docs to speak out, believe it or not, in 2009 was Laura Esserman, a breast cancer surgeon and oncology specialist in San Francisco, who would, of course, be pretty well qualified to talk about cancer screening. She co-authored an article published in the Journal of the American Medical Association, which stated that routine screening for breast and prostate cancer was not reducing the incidence of aggressive and late-stage cancers, which was the original goal, of course. She also was the subject of hate mail, but now reports that things have changed and women from all over the world are consulting with her because she advises doing nothing in response to a diagnosis of DCIS or ductal carcinoma in situ. DCIS is often referred to as zero-stage cancer, but diagnosis has historically been followed by aggressive treatment that can include mastectomy or lumpectomy, radiation, and often a 5-year course of hormone blockade drugs. This is a lot of treatment, particularly considering that a study of 100,000 women followed for 2 decades showed that women were diagnosed and treated for DCIS had about the same risk of dying of breast cancer as women in the general population. This essentially means that for most women, the risks associated with screening and treatment for early or non-existent cancer far outweigh benefits. In fact, there just aren't any benefits. Dr. Esserman says, quote, getting a biopsy is not pleasant. And 75% of the biopsies we do turn out to be nothing. You stick a needle in the breast, and sometimes you'll see these little calcifications that are benign. But incidentally, there's focus on DCIS, and the next thing, someone's getting a bilateral mastectomy. You think these things don't happen, but they actually happen all the time. Overdiagnosis is not limited to breast cancer. The same is true for prostate, melanoma, and thyroid cancer. The reason is technology, which now detects cancer at earlier and earlier stages, including stages at which the cancer poses little to no threat to the patient. A recent meta-analysis of 18 randomized clinical trials, including over 2 million people, concluded that, quote, the current evidence does not substantiate the claim that screening tests like mammography, colonoscopy, and PSA testing saves lives. This is also true of skin cancer screening. The incidence of melanoma is now 6 times higher than it was 40 years ago due to the fact that more and more doctors are looking for it, but the death rate remains the same. There are no randomized controlled trials showing that melanoma screening reduces the risk of dying of melanoma. Cancer screening expert Aid Anderson of Dell Medical School agrees, stating, quote, "In our exuberance to find these cancers, we've basically turned a lot of healthy people who are not destined to die from the cancers into patients." He adds that screening 1,000 women for breast cancer results in saving one woman from early death, but many of the other 999 will endure false positives, painful biopsies, anxiety, and possibly surgery and overtreatment, all of which can result in harm. In other words, the incessant screenings are finding disease that we may all be better off not knowing about. The main reason that cancer screening remains a booming business certainly isn't clinical outcomes, it's economics. It's estimated that the screening business generates about $80 billion in sales annually in the US, and screening is the way to recruit patients for the cancer treatment industry, which costs hundreds of billions of dollars annually in the US. A credible voice of reason is Rita Redberg, former editor of the Journal of the American Medical Association. She says, quote, "I don't think people feel better from all these screening tests we do, and they lead to a lot of complications. I think we would make a lot more impact if we worked on public health campaigns to stop smoking, stop vaping, increase physical activity, and improve our diets. That would really reduce cancer, and people would feel better." And that indeed is the case. And that's what we should be focusing on. If we would take even just a tiny fraction of that $80 billion and offer more public health programs, real public health isn't screening and screening and screening and testing and what it spends its time on. Public health should be about improving public health, the people who live in the public. And you don't do that through screening, you do that through diet and lifestyle habits, which brings me back to, if you're interested in improving your diet, lifestyle habits, at least join Wellness Forum. We offer a ton of benefits for not a whole lot of money, lots of opportunities to learn. And then you may want to consider joining me next weekend for Optimal Health and Life with Pam, Part 2. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you tomorrow with more news.